The sphenoid bone forms the base of the cranium and is located in the middle of the skull. This amazing bone has many functions, such as locking the pieces of the skull together and bearing the weight of the bones above. It also helps to form the base of the cranium, the sides of the skull, and the floor and side of the eye socket. The shape of this beautiful bone resembles a butterfly, with the two greater wings and the two lesser wings forming the wings of the butterfly. The most superior two sets of wings extend laterally on each side of the bone. The greater wings are the larger processes that extend laterally on either side and are the site of the origin for the temporalis muscles. The greater wings articulate with the squamous and petrous portions of the temporal bone. They are perforated by various foramina for nerves and arteries to pass through, such as the superior orbital fissure, the foramen rotundum, foramen ovale, and the foramen spinosum. The lesser wings are the two thin triangular plates located superior to the greater wings projecting laterally. They are processes that extend laterally on either side, containing the optic canal. The optic nerve passes from the eyes to the brain through this canal. Located between the lesser and greater wings are the superior orbital fissures. These are foramina in the sphenoid bone for important anatomical structures to pass, such as the trochlear nerve, abducens nerve, and the superior and inferior divisions of the ophthalmic vein. These veins and nerves that pass through the superior orbital fissures can potentially be damaged during trauma. This damage may cause paralysis of the extraocular muscles, which are the 6 muscles that control the movement of the eye. This damage may also cause loss of vision by injuring the nerves and veins, or by inflammation caused by the injury. Below the greater wings are the pterygoid processes. They are both lateral and medial processes on each side. These processes project inferiorly from the body of the sphenoid bone. The sphenoidal processes of the palatine and the ala of the vomer articulate with the medial processes. The lateral and medial pterygoid muscles insert onto both the lateral and the medial processes and elevate the mandible and try to move it in a horizontal direction during mastication. The sella turcica sits between the two greater wings in the body of the sphenoid. The word sella turcica comes from the Latin sella, meaning seat, and turcica, meaning Turkish, meaning a Turkish chair. That is a saddle-shaped depression. The seat of the saddle, which is the deepest part of the sella turcica, is the hypophyseal fossa. This is the fossa that houses the pituitary gland or the hypophysis. 3 holes perforate the greater wing on either side. The foramen ovale is in the greater wing. The foramen ovale is posterolateral to the foramen rotundum and anteromedial to the foramen spinosum. It is the larger of the 3 holes and allows multiple nerves to pass through, such as the mandibular nerve, lesser petrosal nerve, and the motor root of the trigeminal nerve. Although small, the foramen rotundum is just large enough that a portion of the trigeminal nerve passes through the foramen. The third foramen in the greater wing is the foramen spinosum, which varies in size and is lateral to the foramen ovale. This foramen is a path for the middle meningeal artery, middle meningeal vein, and the meningeal branch of the mandibular nerve to pass through. The optic canals are also paired foramina in the sphenoid. These canals are the path for the optic nerve and ophthalmic artery to pass into the orbital cavity. There is a possibility of direct trauma to the optic nerve that passes through the optic canal, oftentimes occurring from an orbital fracture associated with midfacial fractures. This direct trauma may result in blindness. Another medical problem that is related to the sphenoid bone is sphenoid sinusitis. Sphenoid sinusitis is an inflammation of the mucous membranes of the sinus cavities. This inflammation can cause headaches, facial pain, infected nasal drainage, as well as nerve irritation. Sphenoid sinusitis can be severe. Small additional cavities or tumors may arise, needing a sphenoidotomy. A sphenoidotomy is a surgical procedure in which the sphenoid sinus is cut, creating an opening into the anterior or front wall of the sphenoid sinus. There may also be a need for a more invasive procedure called the sphenoidectomy. A sphenoidectomy is when part of the sphenoid is removed. The sphenoid sinus is opened by removing the front wall of the sinus and allowing it to drain directly into the nasal passageway. This is typically done when there is a tumor present. Injuries in the sphenoid bone are not common due to the bone's location. Fracturing of the bone may occur following severe bumps, impacts, or whiplash. When fractured, the possibility to affect vision or cause nerve damage arises. However, this is not common. This video was prepared to fulfill part of the course requirements of Biology 11 at Saddleback College.